Hello everyone, this is Dr. Sushma Sarila, consulting homeopath at Fidicus Homeopathy. Now let us get into the topic to know more about types of myolysis. The first one of type of myolysis is called as thermomyolysis. So what is thermomyolysis? As you can see here in the picture, this is uterus and these are the fibroids. The red circles are the fibroids, right? So what do they do in thermomyolysis is that they do a small puncture in the abdomen. A small puncture is made in the abdomen, and with the help of the puncture, some instruments are inserted. What are the instruments? It is a lab. Sometimes there can be a handpiece for whatever a procedure. If it is a thermomyolysis, then heat probe is inserted, and then camera can be inserted. So certain probes are inserted into the fibroid itself one by one, and then what happens is after insertion of these instruments, the camera, the handpiece, the probes and all, they will be inserting it into the fibroid, and after inserting they will be applying heat to this fibroid, and by applying heat to this fibroid, what will happen? There will be coagulation of the fibroid. So one after the other, heat is applied to all the fibroids, and the fibroids will start to coagulate and they will start to shrink. So this is called as thermomyolysis here. Here they are using heat to destroy the fibroid. That is very, very important in thermomyolysis. Next, coming into the cryomyolysis part. As you can see here in the picture, the uterus is with fibroids. The red circles are the fibroids, right? Same manner how they have done the thermomyolysis, we have been doing the cryomyolysis. Here they will be inserting or puncturing a small hole in the abdomen. Through the hole, they will be sending a camera, a handpiece, and whatever instruments are necessary, and they will start inserting it into the fibroid one after the other. Here they are freezing the tissue. By freezing the tissue, it will become like an ice globe, and through USG they will be seeing it, right? So whenever they are doing this cryomyolysis, this ice globe dimensions are clearly mentioned, or they can clearly see this ice globe in the USG, so they will know how far they have targeted, what are the dimensions of the ice globe, and else all of the other necessary things that they need to know. So cryomyolysis is intense application of cold or intense freezing of a certain tissue so as to make it dead or shrink. So this is called as cryomyolysis. This is also a second type of myolysis. Now the next kind of myolysis is called as ultrasound guided myolysis. Here it is not invasive kind of a treatment, or they're not going to do any punctures or any sort of holes in the abdomen. So what they're going to do is they're going to select the fibroid through the USG scan, and they're going to focus it with ultrasound waves, and high intensity ultrasound waves are going to destroy this fibroid. So this is ultrasound wave or ultrasound mediated myolysis. But the problem with this one is we do not know if it will destroy the fibroid completely. We do not know if the symptoms will subside, and we do not know if you are planning for pregnancy. We do not know what kind of this ultrasound can cause an effect on the baby, because it is of high intensity nature. So that is the third type of myolysis. And what are the other types of myolysis? You can use, apart from this energy sources, we can use laser techniques, we can use high radio frequency waves. All of this can also be targeted to the fibroid and destroy the fibroid itself. So these are some of the types of myolysis. Next, coming into what are the benefits of myolysis. Why have we done this myolysis as such? Because we wanted to destroy the fibroid tissue. So that can be done, selective destruction can be done, and not apart from the fibroid, the other uterus is healthy, it is not being destroyed, so that is a good thing. Next one is shrinkage of the fibroids. This is very important because shrinking the fibroids will help in relieving the symptoms, right? And it will also help so that it will not grow. So that's also a main benefit. And apart from that, after the reduction of the symptoms, you can see that if you have reduced symptoms, you are healthy. So all of these are the benefits of myolysis. If you're someone who's suffering from fibroids, adenomyosis, endometriosis, PCOS or PCOD, or if you're someone who's suffering from bulky uterus, dysmenorrhea, Bartholinsis, any of the female reproductive organ diseases, you can contact or you can choose Fidicus Homeopathy, as we have high success rates. Here we have two kind of consultation options. The one is the online consultation option. The second one is the offline or the in-person consultation option. If you're someone who's staying nearby the nearest branch of Fidicus, you can come and contact us in person. But if you're someone who's staying far away from the nearest branch of Fidicus, you can contact us online through audio consultation options or through the video consultation options. And after the doctor consultation has been done, we will ask you for investigations, whatever are needed for your condition. And if you've already got those investigations done, you can share it with us. After this whole procedure is done, especially to the online clients, we will be delivering you our medications to your doorstep. If you're staying in India, it can take 3 to 4 business days. If you're staying in USA, it can take 3 to 5 business days. If you're staying anywhere else across the globe, it can take 4 to 8 business days. We're mentioning here clearly it will take business days because holidays and other things are not included in this. Particularly 3 to 4 business days is what we are proposing. If you're someone who are suffering from female reproductive organ diseases and you would like to get in touch with us, you can call us on this number. You can WhatsApp us or message us on this number. If you're someone who wants to know more about Fidicus Homeopathy, you can check our website www.fidicus.com. If you're someone who's suffering from fibroids, if you're someone who's suffering from endometriosis, adenomyosis, or if you're someone who's suffering from bulky uterus, dysmenorrhea, PCOD, or any other female reproductive organ diseases, and you would like to choose homeopathy because we've told you how homeopathy works best for all of this, why should you choose Fidicus Homeopathy apart from other homeopathy doctors? Remember that Fidicus Homeopathy stands for highest chance of health. Here, compared to other doctors in homeopathy, we have highest success rate. We have top-notch doctors and we are treating it with high success rate. First thing. Second thing, we have transparent treatment. What do you mean by transparent treatment? We do not have any gray area between the patient and the doctor. Here we will be talking to you about your prognosis and also about the condition of your fibroids also, and also the personal care here at Fidicus is top notch. So if you want to choose health, if you want to choose cure, if you want to choose a doctor who is going to address all of your issues, answer all of your queries, choose Fidicus Homeopathy. Thank you.
Fidicus Homeopathy.